Look, a rhinoplasty is an operation that does a couple of things. It helps to change the level of function of someone's nose and their nasal cavity, plus or minus changing the overall shape and size and position of their nose to get a cosmetic or aesthetic change that they're happier with. It's not an operation that you recover in terms of your appearance. You don't recover and get back to how you're going to be quickly. So the swelling in the nose persists for some time, and most of us would wait at least 12 months before having being comfortable that the swelling has settled down sufficiently to be able to say this is how the overall shape and appearance of your nose is going to be into the future. But even past 12 months in some cases is not uncommon though. So it does take time for it to really properly settle down. In terms of the short term though and downtime from work and things like that, usually there's a plaster. So if there's any bony work done, which is reasonably common, especially for dorsal humps and things like that, where we want to try and shave the nose bridge down, then there's usually a plaster that's applied for about a week. You're going to get bruising and swelling that's fairly significant for the first 2 or so weeks. It's probably about 5 to 6 weeks before that visible, obvious swelling really properly settles down. But as I said, it's a good 12 months for all the subtle swelling to properly subside. It depends on people's racial backgrounds. So for most people from a Caucasian type background, European background, the main concern is about the overall size of the nose being excessive. So it's wanting to try and reduce the size of the nose. And the areas that people tend to focus on are the dorsum of the nose, which is the nose bridge, and reducing a bump or a hump in that region. And then it's changing the tip. So the tip can be all sorts of different shapes and sizes, but oftentimes people have a bulbous tip or a tip that's quite blobby, and they want to refine that tip. There's also projection, so how far that tip projects from the cheek, and the position of it. Is it too high or too low? So there's all sorts of different issues, and obviously everyone's going to be individual as to what they're trying to address and what they're trying to improve on. And then obviously there's different racial profiles. So Asian noses tend to be more hypoplastic, so be smaller. And so generally with Asian patients, we're trying to augment the nose by building up projection and increasing the height of the nose bridge. So it really just depends on the individual. So it's sort of the ultimate sort of bespoke procedure, really.